Members of the White House coronavirus task force testified on Capitol Hill yesterday, and it was the first time in a long time that we heard from Dr. Anthony Fauci, who, of course, as you recall, is the nation's top infectious diseases expert. And he told lawmakers that the next few weeks are going to be crucial when it comes to the coronavirus. Laura Podesta has more on what he had to say.
Kung flu, yeah.
Cheers broke out at a student-run rally in Arizona as President Trump used the derogatory phrase to refer to COVID-19.
27.5 million tests.
The president expressed displeasure with how the high number of tests has led to a high number of reported cases.
We want to do testing. We want to do everything, but they use it to make us look bad.
He derided testing at a rally in Tulsa last week.
So I said to my people, slow the testing down, please.
On Capitol Hill, members of the White House coronavirus task force told lawmakers they were never told to slow testing down.
In fact, we will be doing more testing.
The health experts do say they're concerned about a disturbing surge of infections.
I am very cautious, and I still don't sleep well at night because we have a long way to go.
Arizona is one of more than 24 states seeing a spike, though few rallygoers were wearing masks.
Plan A, don't go in a crowd. Plan B, if you do, make sure you wear a mask.
California reported 6,000 new cases, and demand for testing is outpacing supply.
So when I went to the website, I couldn't even get on. It just said that all appointments are full. Go to your doctor if you're sick.
In Texas, new cases topped 5,000 for the first time.
Unless you do need to go out, the safest place for you is at your home.
Governor Greg Abbott is allowing local officials to impose limits on outdoor gatherings of more than 100 people. Laura Podesta, CBS News.
Dr. Anthony Fauci also weighed in on how institutional racism is contributing to the disproportionate impact that the coronavirus pandemic has had on the Black community in that hearing on Capitol Hill yesterday. Here's what he had to say.
I think the question was, would I consider institutional racism as contributing? No, I don't think there's... Yes, thank you, Congressman. Well, I mean, obviously, the African-American community has suffered from racism for a very, very long period of time. And I cannot imagine that that has not contributed to the conditions that they find themselves in economically and otherwise. So the answer, Congressman, is yes.
It was such a remarkable moment, Anne-Marie, for the nation's top infectious disease experts to acknowledge that institutional racism has played a role in how this pandemic has disproportionately affected African Americans. And new federal data reinforces Dr. Fauci's response, showing that Black Medicare recipients with COVID-19 are nearly 4 times as likely to end up in the hospital compared to their white counterparts. So for more on this, let us bring in Dr. Shoshana Ungerleider, an internal medicine physician at Sutter Health. She joins us now to break this all down. So doctor, explain to our viewers what factors could be contributing to this data.
Thank you, Vlad. This new data confirms what we've been seeing since the beginning of COVID, really. People of color, and specifically Black Americans enrolled in Medicare, as you pointed out, which is mostly people 65 and older, have been hospitalized with COVID at nearly 4 times higher rates than white people of the same age. We also know they're much more likely to die of COVID, and this is actually observed at all age groups. So there's several factors at play here. We know Black and Latinx people are more likely to live in densely populated housing or live in multi-generational households with older family members where COVID can more easily spread. They're more likely to work in essential jobs, have less access to regular medical care. They have higher rates of things like high blood pressure, diabetes, obesity, and lung disease, which lead to worse outcomes if infected with COVID. So what we're really seeing here are the long-standing, significant racial disparities playing out quickly in real time during COVID.
Dr. Fauci also talked about the prospect of a vaccine, and his timeline is pretty much the same. It looks like closer to the beginning of next year, but he warned about distributing a vaccine too soon. I want to say, too, I listened to his words, and I wish I had my notes in front of me. But though he said sort of the beginning of next year, There are some qualifying words. It's an optimistic schedule. What's the danger of distributing a vaccine too early?
Yeah, Anne-Marie, vaccine development is a slow, deliberate process for very good reason. The testing moves slowly on purpose so that, well, really, because the human body responds slowly. So in these test subjects, it can take weeks to produce the antibodies that can provide immunity, and it can take longer to show any possible harmful side effects. So creating and distributing a vaccine without doing all the necessary testing can be very dangerous, and that's the last thing that we want.
You know, and it was good to hear Dr. Fauci somewhat optimistic, Dr. Ungerleider, but I'd also note that, you know, we don't still have vaccines for HIV, for example. If we were to come up with a vaccine for this coronavirus, it would probably be historically one of the fastest vaccines ever brought to the market, to the public. But there's also the potential, just like the common cold, there is no vaccine against the common cold, which, correct me if I'm wrong, I'm not a doctor, but isn't the coronavirus at least a form of the common cold?
Yeah, so that's right. There is no vaccine for the common cold. Coronaviruses, of which there are many, this is just one of them, have been around for a very long time. This one is wreaking havoc in a very specific way. And so it is very important that we deploy lots and lots of resources, as we are, to come up with a vaccine. We all want to see a vaccine as quickly as possible. But again, the important thing here is that this vaccine is safe and doesn't cause harm to people. I think we can be hopeful, but the accelerated timelines that have been put forth by federal officials are possible in theory, but I think extremely optimistic, as you and many others have pointed out, and really depend on everything going right at every stage. I think if we look at history, lots of vaccines that looked good out of early phases didn't turn out to be good products. And honestly, it can take years to develop a vaccine that works and is safe. So I think, just to be very honest with the public, we still have a long road ahead. And right now, I think what the American people need to know is that their behavior matters. We're seeing all these cases go up rapidly in much of the US. ICUs in many places are filling up with very, very sick patients, and many tens of thousands of people are dying of COVID. I think most people haven't spent time in an ICU, but I can tell you it isn't somewhere that you'd ever want yourself or a person that you care about to end up. So it's up to all of us to keep our families safe. If not for yourself, for your parents or your grandparents, everyone needs to consider their behavior, their actions. Stay home if you can. Always wear a mask in public, distance from others. And if you have to go out, wash your hands.
Doctor, really quickly, Mayor Bill de Blasio says that city beaches will be open for swimming as of July 1st. We don't get a lot of guidance. I've complained about this before. Presumably, people are not wearing their masks in the water. Do you have any advice for people who might be heading to the beach, not just with their own families, but they might be meeting up with, friend groups that they haven't seen in a while, and of course, they might be swimming?
Sure. So if you decide to go to the beach, check first to see how crowded it is. Even though, staying outdoors is safest, we know that a crowded beach can put you at much higher risk of COVID infection. Stay home if you're vulnerable, meaning if you're older or have underlying medical problems, and definitely don't go out if you feel sick. Go with a small group of people that you know and that you trust. The larger the group, the greater your risk. Bring your own chairs and toys, along with disinfectant wipes and hand sanitizer. Consider that everything that you touch could be contaminated, and bring 2 face masks in case one gets wet, and wear it. Be sure to keep your distance from others on land and in the water. I like to say at least 10 feet away from others, just to give yourself a buffer. And don't swim up next to other people where they could cough or spit or their breath could get on you. And again, pay attention to these crowds. It's important to leave the area if it becomes too crowded. And remember to keep washing your hands while you're out.
Dr. Shoshana Ungerleider, thank you so much.
Thank you.